Welcome. In this video, we are going to discuss the anatomy of the craniocervical junction. What is craniocervical instability, also called atlantoaxial instability, upper cervical instability, or CCI for short? What symptoms can this condition cause? How does holistic integration treat CCI patients? What is the atlas, or the C1 vertebra, and why is it so important? The atlas, or the C1, supports the head. The C1 vertebra forms a ring-like structure that rests on the top of the spinal column and supports the weight of the skull. It facilitates neck movements. The C1 vertebra allows for a wide range of neck movements, including flexion, extension, and rotation. This is achieved through its articulation with the C2 vertebra, or the axis. Here on the model, you see flexion, extension, and rotation. The atlas also protects the spinal cord. The C1 vertebra encloses the upper part of the spinal cord and bottom of the brainstem, providing structural support and protection. It anchors muscles. The transverse processes of the C1 vertebra serve as attachment points for the muscles that help stabilize and move the neck, and also allows blood flow. The transverse foramina of the C1 vertebra provide passage for the vertebral arteries, which supply blood to the brain. What is the axis, or the C2 vertebra, and why is it so important? The axis, or the C2, support both the atlas, the C1, and the head. It protects the spinal cord. The C2 vertebra forms part of the bony tunnel that encloses and protects the spinal cord and brainstem. It assists in facilitating neck movements, as we just saw in the 3D model, and it helps to stabilize the cervical spine. The C2 vertebra contributes to the overall stability of the cervical spine, preventing excessive movement or injury. What is craniocervical instability? This occurs when the craniocervical junction becomes destabilized. The craniocervical junction is the complex area where the skull and the upper cervical spine connect via ligaments, muscles, and tendons, specifically the base of the skull, the atlas, or the C1, and the axis, or the C2. This region houses important structures like the brainstem, spinal cord, cranial nerves, blood vessels, and lymphatic pathways. The craniocervical junction is crucial for both stability and mobility of the head and neck. Symptoms are commonly caused by misalignment of the C1 and C2 vertebra as a result of the craniocervical junction becoming destabilized and injury to the soft tissues, especially the ligaments. In turn, this causes interruptions of nerve pathways, blood flow, cerebrospinal fluid, and compression of these critical structures due to instability and misalignment. Symptoms of craniocervical instability include, but are not limited to, dizziness, brain fog, headache, migraine, neck and jaw pain, sleep disturbances and insomnia, blurry vision, visual disturbances, tinnitus, fullness of the ears, POTS symptoms, GI and digestive issues, arm and extremity pain and weakness, chronic fatigue, dysautonomia, anxiety, and the feeling of a heavy head. Common causes of craniocervical instability include, but are not limited to, head and neck trauma, whiplash injury, high-velocity chiropractic manipulation, and sports injuries. There is hope. At Holistic Integration, how do we treat craniocervical instability? The treatment journey begins with imaging of the cervical spine and craniocervical junction, autonomic nervous system testing, a thorough physical exam, targeted labs to look for concurrent systemic factors, and evaluation of corresponding organ systems. Atlas orthogonal C1 adjustment. If needed, atlas orthogonal adjustments use precise imaging, exact measurements to the millimeter, and a sound percussion device to gently and painlessly realign the C1 vertebra into its correct position. Moving the atlas into correct alignment and getting it to hold is a critical step in healing surrounding soft tissue injuries and alleviating many CCI symptoms. We not only look to realign the atlas, but also believe it is critical to maintain optimal spinal alignment to promote the best healing environment for the body. Thus, We also utilize gentle chiropractic mobilization techniques to align other corresponding structures like the jaw, pelvis, sacrum, and other spinal vertebrae. In addition to spinal alignment, we also address corresponding organ systems from a functional and foundational standpoint to better support the adjustment's ability to hold and the body's ability to heal. Combining the structural adjustments and the functional health aspects together provides superior results for our patients, particularly those struggling with CCI. Holistic integration offers balance retraining, posture correction, acupuncture, physiotherapy, energy channel and meridian therapy, and more. If you have been diagnosed with craniocervical instability or suspect your upper neck may play a role in your medical condition, visit us online at holisticintegration.com or call us at 317-848-8048 to learn more. We are accepting both local and out-of-town patients. Holistic Integration, structure function care for your healing journey.